And joining me in the studio is Dr. Alfred Murage, who is a consultant gynecologist. Welcome into the studio.
Thank you.
And antenatal care, of course, is something that has evolved over time, because I think in the olden days you'd have, ladies get pregnant and voila, they deliver. But I think over time it's become a matter of concern. Maybe you can just start by, first of all, letting us know what exactly is antenatal care.
Thank you for having me. Antenatal care is very important when women become pregnant, because it ensures that the pregnancies are well monitored and also helps us have the best possible outcomes for these pregnancies. So what we advise nowadays actually is when couples try to conceive, they can start with what we call pre-pregnancy care. That means they get themselves checked out in terms of their prevailing health, in terms of things that they could avoid in order to have a very normal pregnancy, and in terms of other precautions that they can take when they are preparing for the pregnancy.
Okay.
And this includes, what is being talked about, called IFAS, iron folic acid, during the preparing during the pregnancy. And every couple, especially if they're planning a pregnancy and they know very well that's what they're planning, should do their best to try and do a pre-pregnancy check, and then as soon as they get pregnant, then they start antenatal care.
Okay, so do we actually have a pre-pregnancy clinic? Do we have something that something that is formalized and put in hospitals that is pre-pregnancy?
Yes, we actually do have pre-pregnancy clinics. They're not very well known about, but when couples come into contact with us during routine hospital visits, we make them aware that it's best to plan pregnancies, and especially for people who have other conditions like diabetes, like hypertension, for example, it would be very well if they started with pre-pregnancy care.
Okay. It
is an opportunity to try and optimize the conditions they already have, and sometimes change the medications that they are on, which might be detrimental to pregnancy, and then start on supplements that would be good for starting the pregnancy.
Okay, so what you're saying in short is that from the time you plan to have a baby, one should actually attend a clinic to be sort of advised on the best way to go about it.
Yep, yeah, that would be good, and especially in this day and age where most of our lives tend to be very well planned. If we can plan for other things, then we should as well plan for pregnancies and try to optimize things as much as possible before the pregnancy ensues.
Okay.
Yeah.
Before I go to my next question, just to remind you that are watching, you can participate in this conversation, and the phone lines are open. If you have a question for Dr. Murage, who is a consultant gynecologist, feel free to give us a call, and he'll be more than happy to answer your question. Today we're talking about antenatal care. And Dr. Murage, what are some of the things that one should prepare for and know in a pre-pregnancy clinic? Because I think getting pregnant has traditionally just been, you just try and you get pregnant or you wait. So what are some of the things that one should actually know in the pre-pregnancy preparation?
Part of it we've already mentioned, optimal health. We want people to reduce whatever toxins they might have been taking. For example, couples who smoke, it's best to stop smoking. People who drink alcohol, is best to try and stop that as well. Optimize weight as well, because women who get pregnant with an optimal weight have best pregnancy outcomes. And on top of that, then start on supplements, and folic acid is the key supplement to start on.
Okay. How long before the actual time of trying to conceive should one now, begin living this healthy lifestyle in preparation?
I would say as much as possible. Because you want to have longer term health anyway. So people should try to be in optimal health generally all the time, but especially leading to the pregnancy.
Okay.
Yeah.
Now, there are those who've tried maybe to conceive for a while and it doesn't work. What are some of the things that may cause one not to conceive?
Yeah. What would say is if people are young, well below 35, before they get any concerns about conceiving, they should try for about a year. And especially when women have very regular periods, that implies they are releasing an egg every month. And the men are also in optimal health. They are not smokers. They are not using other drugs like Mira or even other hard drugs. And they are living together, so having regular sexual intercourse. So good health, all these things being normal, then people well below the age of 35 can wait for up to a year before they seek help. And that's because we observe that normal couples will sometimes take somewhere between 0 months to about a year before pregnancy actually ensues, even when there's not been any problems at all. In the older age group, especially above the age of 35, it's best not to wait that long, and usually a trial of about 6 months should be adequate. And if there's no pregnancy, then the couple should be seen as soon as possible.
But one would imagine the younger you are, the faster you should conceive. So a year seems a long time to wait, especially if you're consistently trying.
Yes, seems a long time to wait. But when we look at data about normal people conceiving, what we see is if you wait for about 12 months, it's only about 85% of couples who will have achieved a pregnancy within a year. Looked at another way, if you were to do something in all these couples, you'll do so much which is usually not necessary, and we're just going to conceive anyway. And because of being young, then it doesn't, it might look long, but then you might avoid unnecessary interventions when pregnancy was just going to happen spontaneously.
Okay.
However, beyond the year, then there's reason to get seen. And what I forgot to mention is, if there's regular periods, if couples are not living together, or if the men have any illnesses that might affect their sperm production, then it would be good to be seen earlier than about a year.
Okay.
Yeah.
Are there certain foods or diets that would enhance potency?
Well, that gets asked quite a lot. But generally what we would urge people is to stay in as optimal health as possible. Things that interfere with a good sperm quality, especially in men, would be things like smoking. Smoking is bad news. Mirror as well, and excessive alcohol consumption, and being overweight. So if men are watching all these things and keeping themselves healthy, then by all respects they should have normal sperm production.
Okay.
Yeah.
Traditionally, it's been almost like a woman's problem when she does not conceive, to a point where she will, sort of be asked to go and be checked, whereas the man, goes scot-free. How important is it for both who are trying for a child to be checked up if they've gone past the 1 year or the 6 months, depending on their age?
Yeah, that's a very good question, and it's very important to emphasize that conception is not a woman's thing. It's both the men and the women. In fact, what we see for couples who have problems conceiving, about 30% of the time, that's about 1 in 3, is purely a problem with the men. And therefore, if these men don't come to our clinics to try and seek help, then they would actually, will be directing our efforts on the wrong side. So in general terms, what we want is, if a couple have had delayed conception, they should come to a conception clinic together, get assessed together, and then we usually would work out, what's the thing to do for both of them or either of them.
Okay.
Yeah.
Let's look at contraceptives. There is general fear that sometimes when you do too much of contraceptives before, when it's time now for you to conceive or try to conceive, it may have an impact. Is this true? And if so, what's the impact?
The general thing to say about contraceptives is they're very effective in planning pregnancies. And people who use contraceptives which are very effective then will avoid having unwanted pregnancies, which is very important. Now, most contraceptives do not delay conceiving as when they've been stopped. And the common contraceptives are the pills, for example, what is called the intrauterine contraceptive device, for short IUCD, the people who get what is called implants put under the arm. And then there are barrier methods which are not as effective as the others trying to prevent pregnancy. But in a general sense, every reversible contraceptive should not have a longer term effect on conception after the contraceptive has been stopped. There's one to mention called Depo-Provera, which is a 3-monthly injection. Women who are on that for long periods of time sometimes can have a delay in their periods coming back, which would mean that during the time the periods are not back, then they will not conceive. But in general terms, reversible contraceptives are just what they are. Once it's stopped, then pregnancy should ensue straight away.
Okay, generally speaking, if you're using a contraceptive, should there be like a time lapse you give yourself between the time you stop and when you should expect to conceive? For instance, if you want to conceive a month down the road, is there a specific time that you should give yourself to stop?
Not necessarily. For example, the pill, as soon as the pill is stopped, then its effect is gone, and the next cycle should be a cycle where resumption of ovulation takes place, and the women should expect that they could conceive anytime as soon as they stop the pill. So is the IUCD, the coil, so is the implants. So once the contraceptive is stopped, periods resume, which are just normal periods because of ovulation, then conception can occur anytime, even as soon as the first month after the contraception is being stopped.
Okay. There are quite a number of contraceptives available right now. How does one identify what works for them? And again, there's also been a lot of debate on some of them having very severe side effects on some people and not on others. For instance, weight gain, like sudden weight gain. There are some even who have argued that they're associated with things like stroke. Is this true? And how does one identify what works for them best?
Yeah, what we normally would advise is when a couple is in need of contraception, they should go to a family planning clinic. And what would happen is the lady will be assessed in terms of what suits her best, depending on her prevailing health situation. There are some people, for example, who are not suitable for using the pill. For example, people who are hypertensive, they should be cautioned if they are going to use the pill, or people who have other certain chronic illnesses. So each contraceptive would be tailored to what is the prevailing health condition of the individual and what suits them best and what does not interfere with their current state of health. Because the thing you want is for them to prevent unwanted pregnancy and to remain in their optimal state of health. Optimal
state. All right. Okay, remember that you can ask your question to Daktari, who is in the studio, Dr. Murage, who is a consultant gynecologist. And I'll take a call now from Irene in Mombasa. Good morning, Irene.
Good morning.
Yes, to your question.
Okay, I'm Irene Omolo. I'm in Mombasa. So my question was, I'm 7 months pregnant.
Okay.
Okay, and I was on the oral pill. Then I stopped the oral pills and I conceived within a month. Now I'm 7 months pregnant. My worry is about, I found it difficult taking the IFAS. The folic was fine, but the iron, I found them difficult. So what I did, I was on internet Googling on the foods that have the folic acid. So I noted the food, so I eat those foods a lot. So I'm asking if my baby is healthy now that I was not taking the IFAS. So that's what is worrying me. Then the second question, when we are counting the due date, we count from the first day of your last menstrual period. Now I'm 7. I went to do my scanning. I thought I saw my last period date was 1st September, but my scanning was saying my last period date was October. So is the pill had the effect on my conceiving date? Because I stopped the pill at 1st September, I received my withdrawal bleeding, then I never saw any periods until now.
Okay.
Yeah, that's my question. Thank you.
Thank you very much, Irene. We'll take another call from Patrick in Nakuru. Patrick, your question?
Thank you, Michael. Thank you, Michael. My question to Daktari, my wife conceived last year, December, end of December. And after 6 weeks, we went for scanning. And the baby was okay. The baby was, the fetus could be seen, and there would be something seen there. Apparently, after 14 weeks, when we went back for scanning, we were told that the baby stopped growing at 6 weeks. The mother had no problem. She had no side effects. She was very much okay. But we were told the baby stopped at growing at 6 weeks. So at 14 weeks, what she was carrying was only a fetus for only 6 weeks. So she went on, she was cleaned, everything was okay, and I'm shocked what might have happened.
Okay. Thank you, Patrick.
Thank you, KTN.
All right, thank you very much. Daktari,
Yep.
we have two questions there from Irene. Irene has two questions. The first one is a certain contraceptives. I think she called it what, IPAC?
I think it was just the pill.
Okay.
Yeah.
And yes, so does that affect the baby in any way? Is the baby healthy now that she didn't take the supplement that she was supposed to be taking?
Normally, if I got her question right, she was concerned she stopped taking IFAS at some point.
Yes.
What normally would advise is the key ingredient in the supplements is the folic acid.
Right.
However, people who are low on nutrition would also benefit from iron. And the folic acid is beneficial up to 12 weeks of pregnancy. So beyond that, so long as she stays in good health, she's eating all the right nutrients, which she appears to be by what she is explaining.
Yeah, she Googled on the foods that she can get folic acid from.
Then it's with all likelihood her pregnancy should be going on as normal. Beyond the 12 weeks, folic acid may not be completely necessary for people who are not deficient on that, but iron may be for a certain proportion in the population. However, eating all the right foods, green leafy vegetables, iron-rich foods like red meat and all that, then would supplement whatever iron she needs. So it's more likely that her baby would be growing as normal.
It looks like folic acid is very crucial, especially at that beginning point. What are some of the foods that one can eat so that you get it in its natural form rather than taking supplements?
Yeah, but a lot of plant foods contain folic acid. And the other thing is a lot of foods like cereals, for example, are fortified with folic acid. However, studies have shown that whatever is in foods, even the ones which are fortified, is not inadequate amounts to help formation of the baby's organs very early in life. And the key organs is the baby's spine and parts of the brain. So folic acid supplementation, regardless of whatever people are taking in their diet, should still be advised.
Okay, her second question is on calculating the due date. How does one do that? Yeah,
she was right that when your last period was very regular and predictable, you would use that to calculate the due date for delivery. And the other way out is to do a very early scan, somewhere between 8 weeks and about 13 weeks of pregnancy. And that, both of those tend to be very accurate. What we see is when you do scans very late in pregnancy, she was talking of being about 7 months, if I remember correctly. Scans that are done very late have a higher margin of error in calculating the due date. So her due date should not be changed based on the scan that has been done now. Her due date should remain as it was calculated from her last period.
Okay. We move on to the question from Patrick, and Patrick was saying that the wife conceived in December. They went for a check, and after 14 weeks they were told the baby stopped growing at 6 weeks.
Yeah, baby is very unfortunate and can be very hard to come to terms with. But what may have happened is that they must have experienced what we call a very early miscarriage. We call it a silent miscarriage. So when they went for an initial scan, the baby was alive and there was a heartbeat. But shortly beyond that, the baby must have stopped growing. And by the time they went for the 14-week scan, the baby was not alive. So we term that as a very early miscarriage, which can happen for various reasons. Usually not because they have done something that caused it, or either of them has a condition that would have caused it, but usually it's something called chromosomal errors. Chromosome is what it makes genes, and what we notice is when an egg is developing, and even sperms, and during the process of fertilization, there can be errors in chromosomes, and that sometimes can mean a baby is going to be, pregnancy is going to start for a baby who is not going to develop normally, and nature will usually allow that to be lost as a miscarriage.
Okay.
Most people who get very early miscarriages will go on to have subsequent normal pregnancies.
Okay, so they shouldn't worry, they should just try again. All right, we'll take a call from Alice in Kasarani. Thank you for calling, Alice. Your question or comment?
Okay, my question is, I've had
Sorry, Alice, I can't hear you. You need to speak a bit louder.
I'm asking about the e-pills.
I've heard about them, but I don't know how much effect they do in their body, because it is sometimes I fear using them because I'm hypertensive.
Okay.
Is it good to use them for somebody who is hypertensive? The EP, those ones that do work 72 hours.
Okay.
Yeah.
Thank you very much, Alice.
I also wanted to ask this: can you use them today, and then after some time you skip, then you use them another time?
All right.
Yeah.
All right. Thank you very much, Alice in Kasarani. I will also take a call from Regina, who is in Nyeri. Regina, thank you for calling. Your question?
Yes, my name is Regina. I have been trying to conceive for the last 1 year.
Okay.
And last month I went for a HSG test. And the test shows that I have my fallopian tubes are blocked. There's a small dilatation. The tubes are dilated. That's what the X-ray indicated. So I wanted to ask Doctor what kind of treatment I'm supposed to undergo.
All right.
Yes.
Thank you, Regina.
Thank you so much.
All right. We start with Alice in Kasarani, who's concerned about the e-pill. Number one, she's hypertensive. So is it okay for her to use the e-pill? And the second question is on regular use of the e-pill.
Okay.
And maybe for those who may not know, what is the e-pill?
Yeah. The e-pill is the emergency contraceptive, which should be used within 72 hours of unprotected sex to try and avoid getting pregnant in that cycle. Now, the e-pill contains a hormone called progesterone, which does not normally interfere with control of blood pressure, so she should be okay to use it. However, we tell people who find themselves using the e-pill so often, month after month after month, to consider going on an effective longer-term contraceptive, and then that will keep them protected on a medium to longer-term basis instead of getting the e-pill every now and again.
Okay. Are there side effects of the e-pill?
Usually not, nothing longer-term. But generally speaking, it can cause a bit of nausea and vomiting, in which case if it's taken and there's immediate vomiting, then a dose should be repeated. And number two, depending on what phase of the cycle they were in relation to having a period in that monthly cycle, their periods may come slightly later or slightly earlier. And number two, they might have a heavier period in that cycle, and sometimes the next cycle may be slightly delayed as well. So long as people are aware of that, then they shouldn't really be too concerned.
Okay.
Yeah.
Should one be concerned when using the e-pill in regards to ectopic pregnancies?
There has been concern that the e-pill can contribute to that, but a lot of studies don't really support that, and the e-pill is really safe because the aim is to prevent becoming pregnant in that cycle when the pregnancy is unwanted, and it does very well in that respect. If anybody got pregnant after they've used the e-pill, normally would suggest that they get a very early scan that would confirm that the pregnancy is in the right place, and usually that's the case.
Okay.
Yeah.
But I guess generally speaking, the e-pill is exactly that. It's for emergencies. It's not for emergency. It's not made for consistent and regular use.
Yeah, and that's why we're saying if anybody finds themselves using it now and again, they should go to something longer.
Something more long term. Okay, we have Regina in Nyeri who has a blocked fallopian tube. What treatment should she seek?
It's a tricky one for Regina. Number one, what one would want to know is where exactly the block is. And number two, what her age is as well. Because if she's very young and well below the age of 35, and her husband has also been assessed and the sperms are completely normal, then, and depending on where the tubes are blocked, then one may consider whether trying to do a surgical repair is necessary, is appropriate and can work. If the tubes are blocked in a certain point, then sometimes that does not really work, and the way out for blocked tubes sometimes ends up being what we call IVF, test tube babies.
Okay.
The other thing is when women have had, the test she talked about is called HSG, is an X-ray test that tells you about whether tubes are open or not. Sometimes it can tell you tubes are blocked when they are actually not blocked. We call it in scientific terms a false positive result. So what we suggest is, if there's nothing in her history to give us a clue why her tubes would be blocked, then it's best to do something as we call a laparoscopy. That means putting a camera inside her belly button, looking at her pelvis and looking at the tubes and confirming that they are really blocked, and working out at that point whether we can do something in terms of repair.
Okay.
But all these things will depend on her age and, you know, other circumstances.
Okay. For those who are trying to conceive, there's been, you know, notions here and there that depending on the timing, you can time whether to get a boy or a girl. But before we even go to that, is there a specific time that it's best to have intercourse for you to conceive? And how does one tell, you know, based on menses and cycles?
Women who have very regular cycles that are predictable every month normally would conceive would ovulate around about the middle of the cycle. For example, women who have a 28-day cycle, then their ovulation is around about day 14, counting from the first day of the periods, which is usually day 1, and give or take a few days forwards and a few days backwards. So normally from about day 12 to about day 16, that would be the optimal time for conception. And therefore, you know, if they want to time intercourse at that period, then they can have alternate day sex, and likely they would conceive during that interval. The issue about conceiving a boy or a girl it really comes up every now and again. But generally speaking, it's a game of statistics. It's either going to be a girl or a boy, and it's more or less 50-50 in terms of spontaneous conceptions. And there's the sperms are the ones that determine whether we're going to have a boy or a girl. And either the sperm will carry a Y chromosome, which is for a boy, or an X chromosome, which is for a girl. And either of them has a potential chance of reaching the egg first, and therefore would normally say it's 50-50. You'll find a lot of information on, you know, in some, you know, on websites, in some books about having, you know, intercourse at a certain point in time, and therefore maybe having one sex or the other. But generally speaking, it doesn't really work. It's best to regard it as 50-50.
That's still something left solely to God to decide, eh? Maybe you could also mention, because again, traditionally it has been felt that a woman is the one bringing forth girls, for example, as opposed to boys. What would you say to that, and especially to men who feel they want specifically a boy?
I think you know, men should understand that it's really chances. It's going to be a boy or a girl.
It's actually them who provide that.
Yes, and the Y chromosome for a boy comes from the men and not from the women. So I think we cannot blame either sex, either the man or the woman, for having either girls or boys in the family. And it's just, you know, the way nature is. And that's why if you look at the world, there's more or less a balance between men and women. And it's really difficult in terms of natural processes to control that.
Okay. Now, Irene mentioned earlier on that she Googled and found, you know, the food that is applicable for folic acid. What would you say in terms of getting what I'd call internet medicine? In other words, you Google and you self-medicate or take care of yourself based on the internet. Are there dangers?
I would say yes and no. Number one, there's lots of good stuff being sold out there, and that's not in doubt. What you want is, when you're getting something from the internet or self-medicating, you need to know as much as you can what it contains. Unfortunately, you know, there's some things that you'll buy which are not regulated. For example, some herbal products, for example, they don't go through pharmaceutical regulation. So what is on the label may not be necessarily what it contains. And so people should be careful when they buy something which is said to be a supplement that does X, Y, and Z. You know, whatever they are taking sometimes is not exactly what it says. And there's been some studies in the US that show, you know, you'll buy a supplement which is said to be natural or even herbal, that tells you it has A, B, C, and D, but when they've been analyzed, you find that they don't contain as much as they claim, or they contain entirely different things. So I would caution, buy whatever can be authenticated and be careful of things that you self-medicate on.
Okay, finally, as we wind up, let's talk about cravings. And there are certain women who will eat stones, others will eat soil, especially after conception or maybe when they're ovulating. I don't know. Are there some dangers, and what are these cravings indicative of?
Yeah, there's a lot of talk about, women being pregnant and craving for something, and that certainly happens. And people who are in good health generally may crave for things that they want to eat, some certain foods, and so long as they are well prepared, that's fine. Cravings for stones. Number one, we don't really know what these stones contain. They could have some toxic products in them that could be harmful to the growing baby or even to the women themselves. So what we normally suggest is if somebody is craving for something, and especially what is so-called stones, they should see the obstetrician. They can be screened for any nutritional deficiencies, and if they have any deficiencies, then they can be given whatever is going to address those deficiencies. But if they have no deficiencies at all, then there's really no role to eat all these things, because they could be harmful.
Okay.
Yeah.
Now, we also live in an age where we take a lot of supplements, in tablet format, although they're actually representing foods that we probably have. For instance, you can get, is it called, I think, carotene, which is found in carrots. What's the difference between the supplements, which have already been manufactured, and natural? Would one maybe rather go for the natural?
Yeah, that's a good question, and it doesn't just apply for pregnancy. The general advice would be people who are already living healthy lifestyles, eating the right stuff, avoiding toxins like smoking or excessive alcohol consumption, don't actually need supplements. However, people who are already nutritionally deficient, for whatever nutrients, then they may have a role in taking some supplements. And again, if most of the data that guides this comes from the West, where, for example, Americans swallow so many pills a day, and most of the data shows that most of them who are healthy don't actually benefit from taking these supplements. And to some extent, they could actually get into some bit of harm. So if you're healthy, getting the right things eaten, leading a healthy lifestyle, you don't need supplements.
You don't need those supplements.
If you're unhealthy, get to work out what you're deficient of, and then
be specific. Thank you very much, Dr. Murage. I'm told that we're really out of time. Dr. Alfred Murage, who's a gynecologist. Finally, how can one get in touch with you should they need to see you?
Yeah, we run our clinics in Aga Khan University Hospital, Nairobi, and people can get us in Aga Khan.
Thank you very much for coming, Daktari, and thank you for the wonderful advice that you've given us.